Apart from the questions asked by the candidates, anybody wants to ask the patient a question?
I would ask about any recent dental surgeries.
Exactly. Excellent. And my answer would have been yes. What other questions would you want to ask?
Whether the patient has a prosthetic one.
Good.
If the patient is an IV drug user.
Exactly. Thank you. Any other questions you want to ask? Anybody? But overall, the candidate did well, isn't it?
Yes. So.
The jury. Okay, good. Why were you thinking of heart failure? Candidate 2.
Was it
there? Was it there? No, you come to defend. Please defend.
Oh no, Doc, I'm not defending.
No. When I said defend, I'm not saying you come to argue. I mean defend your diagnosis. I'm asking
Doc,
why.
I was asking because in heart failure there's also a systolic member. That's
what. But you didn't ask me. You asked me for top. I said no. PND. I said no. The way you even asked the PND cry is even funny. What's it then? Do I wake up at 9 to open the window? Hey.
Oh no.
Is that PND? So if I wake up at night and I turn on the AC, that's not PND. How would you ask a patient for PND?
Do you suddenly wake up at night to catch a breath?
Exactly. Whether I open the window or I turn on AC, or that has nothing to do with the definition of PND. Do you wake up at night suddenly to catch breath because you are suddenly breathless, or do you have to use a lot of pillows to sleep at night? It's simple. You asked me for autopnea, I said no. Exertional, I didn't say it was exertional, I said I was just feeling occasional difficulty breathing. Exertional dyspnea, no. Autopnea, no. You asked for abdominal swelling, I said no. Bilateral leg, I said no. I just went there with occasional chest discomfort, and then that one it was even 2 out of 10. But occasionally, I sometimes felt breathless. You have fever and chills. So please, the teaching point here is that fever plus a new onset murmur. MCQ takers, are you there? Let me see your shouting. Are you there?
Yes, Doc.
Fever, you go to a clinical vignette. Any patient, fever plus a new onset murmur is infective endocarditis until proven otherwise. Say after me, MCQ. Guys, fever plus new onset murmur is infective endocarditis until proven otherwise. Go.
Fever plus new onset murmur is infective endocarditis until proven otherwise.
Again.
Fever plus new onset of murmur is infective endocarditis until proven otherwise.
So the candidate did very well to rule out rheumatic fever by asking for an antecedent sore throat. She asked for migratory joint pain. I didn't have any of that. She was querying heart failure, so she did that. She was querying MI because the pansystolic murmur could have been from a ventricular septal defect, or my mitral regurg could have been from what? An MI. Nothing of that sort. So based on that, I think that she did well to actually ask her questions very well. But this is a female, and you should not forget there are marks allocated there. You should not forget a basic ONG history. When was your last menstrual period? How many times have you delivered? Do you have any problems during menstruation? It's enough. Is that okay?
Yes.
So infective endocarditis, you got the Osler's notes and all that. So the modified use criteria, please, I have given you a mnemonic and you should not forget that mnemonic. Nana, do you remember that mnemonic?
Doc, yes.
Okay, if you remember, tell me.
Hey. Doc, I don't think I was here. But then I remember something like that. The B friend.
Be friend.
B fever.
Me.
Doc, I wasn't here.
In fact, none of them was here. But it is on YouTube. Modified Dew's criteria. You have major and minor. So the criteria says bacterial the mnemonic says bacterial endocarditis. So the BE is actually the major. Bacterial endocarditis predisposes to vascular and immunologic menace. Does it make sense to you? Does it make sense to you, please?
Yes.
I would give you the components and you see that it will make sense. Okay.
Mm-hmm.
All right. Good. Very good. So the bacterial there stands for blood cultures, and the blood culture should culture what? Typical organisms, isn't it? Blood cultures culturing typical organisms like strep viridans, right?
Yes.
The positive blood culture. The endocarditis there stands for echocardiographic findings like vegetations on the valve. Echocardiographic findings. MCQ takers. The following are minor criteria on of the modified Duke's diagnostic criteria, except you should be able to answer. The P there stands for what? Predisposing factors or predisposition factors or risk factors, okay? Like what Farida and then Chris was saying. So like congenital heart disease, prosthetic valves, recent dental procedures. The list goes on and on and on. Sometimes even IV drug uses. And the MCQ takers should take note that usually infective endocarditis usually will produce the valves that are affected are on the left. But if you have a patient, the question that says that the patient has a right-sided endocarditis, it could be that he was actually abusing IV. It's from the IV, okay, IV drugs. Is that okay? Patients whose endocarditis comes from IV drug abuse would actually have a right-sided or would have right-sided endocarditis. Did the MCQ guys take note of that?
Yes, Doc.
Yo, boss. The T there stands for temperature. 2. So temperature more than 38 degrees Celsius. Then you have the vascular phenomenon. So the V there also stands for vascular phenomenon. Is that okay? So what are some of the vascular phenomena? Yes.
Janeway lesion.
Janeway lesions. What else?
Osler nodes.
You are sure about that?
Yes, Doc.
You are sure Osler's nodes are there? Well, I'm just asking.
Yes, Doc. It's part of the.
Okay.
Yes.
Emboli.
You are sure osseous nodes are vascular?
They are immunological.
So let
immunological.
Farida, yes, they are immunologic. Okay, so it's the Janeway lesions. Okay, the Janeway lesions. Sometimes the the conjunctival hemorrhages. Okay, as far as I can remember.
Okay.
The osseous nodes will fall under what? Is the osseous nodes? What is the feature? What feature would you find in the eye?
Road spots.
Okay. And then the list goes on, and the menace or the menace, depending whatever you want to say, is what? Microbiology. That is what, unlike the first one. So maybe you cultured an organism, but it's not a typical one. Please do you understand? So when you are asked, about, come again.
I wanted to ask where we'll place splinter hemorrhages. Splinter hemorrhages, where will that fall?
Will still I think would be under vascular.
Oh, okay.
But it is not, splinter hemorrhages is not part of the diagnostic. Remember that this is a diagnostic criteria. There are some things which should be there.
Okay.
So although it is, I don't think it's part of the diagnostic criteria. So the modified use criteria, the mnemonic is bacterial endocarditis predisposes to vascular and immunologic menace. Bacterial stands for the blood culture that cultures typical organisms. Endocarditis stands for echocardiographic findings of IE. Then predisposes, that's predisposition factors. Temperature, T for temperature, V for vascular, I for immunologic phenomenon, and then M for what? The microbiological evidence of infection that is consistent with, but is not meeting the major criteria as established. Are we good? Are we good, please? So based on this, how would you investigate this patient? You want to do what? A blood culture. You want to do a blood culture, and they should be drawn at least 12 hours apart from each other. So if you take one at 6 a.m., the next time you take it should not be at 6 p.m. but at 7 p.m. So they should be 12 hours apart. Okay, and so at 2 blood cultures at least, taking 12 hours apart from each other. Please, do you understand? All right. So based on this, what
from 2 different sites?
Come again?
It's not necessary.
Yeah, 2 different sites. Yeah. And some people will even say that at the height of the febrile and a febrile episode. Okay. Hello.
Yes.
Yes.
So based on this, what investigation would you do? You want to do what? A blood culture. You want to do an echo. You want to do a full blood count, like Nanama said. The echo would even help you rule out other valvular heart diseases, heart failure, dilated cardiomyopathies. The echo would help you do all those things. So blood culture, echo, because you are thinking of rheumatic valvular disease, you may also have to do the ASO titers just to be sure that they are not there. These patients, you also want to do BU creatinine to make sure that her fever has not caused a septic ATN and all that. So yes, like she said, the antibiotics are available. You have your penicillins. Sometimes for prostatic valves, you may need to add Vanco Genta, but I mean that is an excellent work done. Just that, please be careful not to forget your basic gynae history. Is that okay?
Yes, Doc.
Okay. Any questions? Any questions, please? Anali, are you okay? Anali, are you okay? Okay, she's not there.
Yes, I'm fine.
Debbie, are you okay?
Yes, Doc.
Ajara, are you okay?
Yes, Doc.
All right, that is fine. Excellent. Please select who is going to